New guidelines from the CDC cutting time in isolation in half from 10 days to 5 days after testing positive for COVID. This comes as an alarming surge in pediatric COVID cases and hospitalizations are raising questions about whether children should even return to school following the holiday break. Joining me now for more is emergency medical physician at UW Medicine in Seattle, Washington, Adeyinka Adedipe. Doctor, thanks so much for joining us. Do appreciate it.
Thank you for having me.
All right, let's start with that major news from the CDC, cutting in half the isolation time for people with asymptomatic COVID infections, not just frontline workers this time, but for everyone now. So I just want your opinion. You think that's the right call?
I think that's right, Phil. That's a game changer. People have suffered tremendously during this pandemic. The infection numbers since before Christmas have dramatically risen, and cutting the dates for isolation and quarantine in half allows physicians and staff to get back to work.
What are you seeing there at your hospital? Looks like
and numbers have risen steadily since about December 14th. The number of cases is high, and the patients are having mild symptoms, which is great. We have a highly vaccinated community here in Seattle. The issue that we're seeing is it's putting a tremendous strain on the staff and the workers in the hospital, whether it's providers, nursing staff, MAs, even registration, social work, and public safety. So these guidelines to reduce the length of time for isolation really helps us out, really allows us to get back to work, particularly if we're asymptomatic. Of course, we're wearing masks and actually wearing N95s when we're interfacing with patients, but decreasing the amount of time for isolation really helps us out.
Well, this pandemic has put a stress on frontline workers from the very beginning. I'm wondering, are you dealing with staffing shortages at your particular hospital right now, and how are you dealing with them?
We are dealing with staffing shortages. What happens is hospital experiences tremendous shortages, and that means there are not enough providers for the patients who come in. And so we cannot accommodate as many people. In order to mitigate that, we've hired up. We've actually hired traveling physicians or traveling nursing staff to fill in the gaps. Some of us have put in a tremendous amount of work over this recent outbreak. The providers and staff at the hospitals do feel the stress and strain of not having enough staffing, not having enough personnel to help the patients, because this is a pretty big surge, and it's hard for us to accommodate patients with run-of-the-mill medical complaints, whether it's an accident or minor trauma or heart attacks, strokes, or otherwise. So COVID really affects every aspect of the work that we do now.
It seems like before you knew someone who knew someone who knew someone who had COVID, and now everybody either has it in their family or knows someone for sure. This raised some eyebrows. The CDC is not requiring people to get a negative test result to end isolation. Do you think that's a mistake to not even have at least one negative test?
I do not, Phil. I think people can self-monitor for their symptoms. They can really pay attention to whether or not they're having a fever, sore throat, continued headache, if their symptoms are getting worse from the time of their positive test. I think we need to be cognizant of the fact that people need to get back to life, and to be able to do that, we really need to trust our populace, our communities, to be able to monitor and self-monitor. And getting a negative COVID test, getting a test in general is very difficult. Having a follow-up test may not be the easiest thing to do for most patients, and it's a better strategy to actually monitor your symptoms. If you're getting more sick or having more symptoms, come to the hospital. We're happy to take care of you. But if you're not having symptoms and your symptoms are mild to begin with, I think a 5-day isolation period is just fine.
All right, doctor, thank you. Quickly, before we go, given the spike in pediatric cases, are you seeing a lot of children coming in right now? And how can you keep the kids safe? Many of them not even eligible for vaccines right now.
That's a great question, Phil. So I am aware that there is a that there are workplace outbreaks at one of our local pediatric hospitals because kids are unvaccinated, and Omicron is incredibly contagious even if you've been vaccinated. So we've taken care of adults who work at one of the pediatric hospitals, and their symptoms are mild. I actually don't have a great answer for how to prevent little kids from running around and enjoying their family during this holiday season. It may be a wait and watch kind of thing over the next few days.
Dr. Adeyinka Adedipe, we are thinking about you, all of the frontline workers. Good luck coming through the holiday season, and we, obviously thank you for everything that you're doing.
Thank you so much, Phil. Thank you for your time.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.